Let's talk about semaglutide for weight loss. Semaglutide is a glucagon-like 1 peptide receptor agonist, and it's similar to exenatide, except that it's dosed once weekly. Now, I have already talked about exenatide for weight loss in a previous video. Today, let's talk about semaglutide. Semaglutide is the generic name for a drug called Ozempic. Also, there's an oral version of that drug called Rybelsus. It's also been rebranded recently as a weight loss drug known as Wegovy. The big difference is that Ozempic is dosed at 0.25 milligrams once a week, all the way up to 1 milligram sub-Q once a week. Meanwhile, Wegovy is dosed 2.4 milligrams sub-Q once a week. So semaglutide works similar to exenatide in that it agonizes the glucagon-like 1 receptors. What this does is it results in decreased and delaying gastric emptying, as well as reducing the secretion of insulin. Glucagon-like 1 receptor agonists are also sometimes referred to as incretin mimetics. Now, one may think that reducing insulin secretion is a bad thing. Not necessarily. Semaglutide doesn't technically stop insulin secretion, but what it does is it reduces and mediates glucose-dependent insulin secretion. What this means to the patient is that if they're on an empty stomach, it's not going to secrete more insulin than they should. Instead, it's going to wait until the presence of food is there for your body to start secreting insulin. As a prescribable weight loss drug, semaglutide is currently the most efficacious medication that is available to be prescribed. In a 68-week double-blind clinical trial, just shy of 2,000 patients, all these patients were classified as obese. In this study, over half of them lost at least 15% of their body weight. Meanwhile, 30%, or just shy of 30%, lost at least 20% of their body weight. Obviously, maintaining a caloric deficit and incorporating resistance training needs to be the foundation of a weight loss promoting lifestyle. But unfortunately, that's easier said than done. Enter why I'm talking about semaglutide, because it helps people feel fuller longer, and they feel fuller and longer on smaller meals and less food. This is why this drug is so good at managing insulin resistance and diabetes, is because patients who are insulin resistant and or diabetic may already have an overabundance of insulin being secreted. Meanwhile, their cells aren't sensitive to the insulin. That's how semaglutide benefits them, is that it attenuates that excessive insulin secretion until there's the presence of food in their stomach. I know this isn't TRT related per se, but I just want to discuss this with y'all, as most TRT patients, or at least the vast majority that I work with, are people that are very health conscious, are people that want to get more out of life, are people that just overall, they just want to feel better. Again, thanks for watching. Appreciate y'all. Have a great day.